Hello, I'm Iris Grimm with balancedphysician.com, where we support physicians to restore their balance, maximize their productivity, and fine-tune their leadership. Today I want to talk with you about residents, and particularly about the challenges that they face when it comes to stress and burnout. Now I know we all know that residency is a stressful time. However, I must admit, I was amazed when I heard how many residents actually leave their training program before they start their career. And I was even more amazed when I read the shocking statistic about residents' burnout. Now, in 2010, a study revealed that 55 to 76% of internal medicine residents experienced burnout. Burnout is defined as a high level of high level of emotional exhaustion, depersonalization, and low sense of personal accomplishments. I could imagine that probably more residents would leave their training programs if they did not have that burden of paying back all of their tuition. Now, it is also said that the job satisfaction rate and even the personal support for residents is less than, for example, for nurses. When they talk about burnout factors for residents, they talk about factors such as not being able to cope with stress, trying to be perfect, they don't have good relationship with colleagues or mentors, they have no control over their schedule, and they just don't have enough time in the day. Now, sure, one can say that's just part of life. They knew this all along, and that's the life that all of the physicians have chosen. But I think that kind of attitude really doesn't leave them much room for new possibilities. After all, I think physicians as well as residents need to learn about wellness and their own personal well-being before they go into the marketplace and before they actually burn out. These numbers also, that also pretty much shows me that hospitals as well as physicians still underestimate the impact of chronic and acute emotional stress on the patient care. It is a known fact that burnout leads to increased medical errors. Burned out residents are more susceptible for drug abuse, alcohol abuse, and even for depression. Now, I know that medical schools don't have the resources or the time to teach their students about stress control and life balance. But I think also that that doesn't mean that they have to be left on their own. It just means that the organizations, the healthcare organizations, have to be more proactive to teach this their residents so that they can save some money in the long run. Now, in my next email, I will share with you the 3 key reasons why non-clinical programs on topics such as work-life balance, stress control, communication, and leadership are just as important as the traditional CME curriculum that residents go through. Now, if you don't want to wait until next week, you can also go back to the email where you found the link for this video. You click on the article title and you will immediately have access to it. Again, my name is Iris Grimm. I'm with balancedphysician.com, and I see you soon.